joined us on. Oh, thank you, Esther. Much appreciation to colleagues from CDF who joined us on Thursday and are back here today for a deep dive in advocacy planning. But before we kick off, let's start off with a quick round of introductions. If you could just say who you are, the organization you're from, and the role that you have within your organization, and we move in that way. I will start. My name is Yemurai Nyoni, and I'm a consultant engaged with Y Plus Global to support the development of advocacy resources and to support as well your advocacy action planning as part of the Youth Care project. And the purpose of this these sessions is to equip you to be able to effectively conduct the activities that you highlighted in your work plans. So who would like to go next?
I can
Hello,
go
everyone.
next.
Oh, okay.
Sorry, Alice. Sorry. I can go next. So my name is Esther Kamau. I work as a finance graduate trainee for Y Plus Global. I'm filling in for Ivy as she was not able to attend this call. Nice to meet everyone.
Hello, everyone.
Hi, Alice. Please go ahead.
Okay, my name is Alison Tuga. I'm working with CDF as a program officer, and I normally oversee advocacy and and part of communications.
Please go ahead, Emmanuel.
So my name is Emmanuel Kachakwale. I'm a programs officer under the Youth Care project based in Kitwe, Zambia.
Hi, everyone.
Hi, Arnold. Please go ahead.
Yes, I'm Arnold Mashawe, working with CDF in Tanzania as a program officer under Youth Care project. Hi, Emmanuel.
Great. Emmanuel, you can go ahead. Wait, no, Emmanuel, you've spoken. Who hasn't spoken? Jerry Kitiabi.
Hi everyone. Hi Yamrai. It's been a while. My name is Jerry Kitiabi. I work with IREP, that is Ambassador for Youth and Adolescent Productive Health Program, as the communications and media manager. Yeah.
Great. Thank you so much. So for those who were not there for the Thursday conversations, we have created 6 resources that can support you in your work under the Youth Care project. And this is one out of the 6. We will have sessions, I believe 3 tomorrow. There should be 1 on Wednesday, and I believe 1 or 2 more on, no, 1 more on Thursday. So for all these sessions, we are asking kindly if at least 1 officer from each of the organizations can take part, if not, to have more. This will help us all be able to share knowledge within our respective organizations, and it will help us also to make sense of the technical resources, which are the guidelines that we have shared or that we are sharing with you. So Ivy and the team are currently finalizing the design of the guidelines, and as I mentioned, there are 6 of them. And the slide deck today will take us through some of the information that you will find presented in a much deeper way within the guidelines. Joven, welcome to the call. We've just begun. Joven, maybe if you could introduce yourself quickly, tell us who you are, which organization you come from, and what your role is in that organization.
Hello, Emily and everyone. My name is Joven Junwa. I'm working with CDF as Assistant Program Officer at Tarime. Thank you.
Brilliant, thank you. And this call is being recorded thanks to Esther and the Y Plus Global team. So it will be available to share after this conversation. If you'd like also to share it with your team members, it may be very helpful. I will highlight that for this to be as engaging as possible, I will ask questions here and there so that we walk together. So we move together to understand advocacy planning. Please do think about the work that you are planning to do. Please feel free to share examples of some of the plans you already have or experiences you've had in advocacy planning. At any point, feel free to ask questions. You can raise your hand. You can write in the chat box. You can also unmute your microphone. If at any point you feel, hey, this is moving too fast, or maybe it's going too slow, feel free to share feedback so this can be as engaging as possible. I'm cognizant of sometimes the data limitations we have. And so I have not put on my video at present, but I might close to the end. Do let me know also if you are able to as well. It will help us to interact better. Right, so just give me a second. So I pull up this document and share the screen with you. So today's session is an introduction to advocacy planning. An introduction to advocacy planning. Right, I'm trying to make this bigger, but I'll need to know if it's big on your screen. Is it big on your screen now?
Yes.
Can you? Okay, great. All right. So maybe to kick us off, last week we had a brief conversation with colleagues from CDF, and one of the first questions we asked was, what is advocacy? What is advocacy? And they had their own definitions, their own thoughts. So what I will do, I'll share what is part of the definition that I found in one of the resources we're sharing from Youth Do It. And then I will invite you to share with me what you think advocacy is from your experience and your work, and then we'll move forward from there. So according to a platform called Youth Do It, they say advocacy is an organized attempt to change policy, practice, and or shape attitudes by presenting evidence and arguments for how and why change should happen. Advocacy is about influencing people with the aim to change policies, practices, structures, and attitudes. So it's very important to pay attention to the aims of advocacy. Where does advocacy change take place? And here it refers to policies, practices, structures, attitudes. For the most part, you will find that advocacy targets a change of policies and laws. But linked to those policies and laws, you'll find attitudes, you'll find knowledge, you will find practices that need to be changed. Policies and laws oftentimes are used to help change the things that we do. So our practices, for example, child marriage. If you want to, or if you outlaw or create a law around child marriage, you are attempting to address the practice of child marriage. If you set up a policy that introduces child marriage surveillance committees at community level, it means that policy is now influencing the creation of structures. In the work that we do to influence a change of policies and laws, we have to address the knowledge and the attitudes of lawmakers. We have to address the knowledge and the attitudes of the public that influence lawmakers. So all these things are interconnected. And when we do advocacy, there's a range of issues and areas that we have to address if we are going to see changes in laws and policies that result in changes in practices and eventually in changes in development outcomes. When I refer to development outcomes, I'm also referring to, for example, health outcomes. So you can talk of reduced adolescent pregnancy rates. We can talk of education outcomes, where we can refer to increased completion rates at school. We can talk of economic empowerment outcomes, which will say, percentage of young people who are employed or who have set up a viable business after completing education. So all these things, they follow and they are all connected. So I'll pause here for now, and I'll ask if there are any volunteers who'd like to share. What would you say is your definition of advocacy? Feel free to unmute, because I'm on full screen. I may not be able to see you if you raise your hand. Feel free to unmute. But I'd like all of us to share our own perspective of what we think advocacy is, so we get started. Emmanuel, Jerry, Joven, Mercy, Alice, what are your thoughts on what advocacy is?
Can I go first?
Yes, please go ahead.
I don't know how to rephrase it, but I'm thinking about being passionately and speaking up and taking action for something maybe you deeply believe in. But at the end of the day, we have to bring change, and it could be in the context of policies and all that.
Right, thank you for those reflections. You've spoken about the importance of taking action. Advocacy is nothing without action, and I find most of the examples I've had of advocacy, you have to believe in what you are advocating for. You have to believe it's important if other people are going to take action on it. So you have to be convinced that's important. Thank you for those important points. Anyone who'd want to add, share their perspective? What would you say?
Can you get me?
Hello.
Hi, okay.
Oh, Joven, please go ahead. Sorry, I'd muted by mistake. Please go ahead, Joven. How would you define advocacy?
With me, I would say advocacy is placing for something that you want to see, the change that a person wants to see, be it in the society or in the nation. And for that, it involves not you only, it's not a one person's work. It has to be a unity, because placing means both. Yeah, that's how I can define them.
All right, thank you for that. All right, I see, Mercy, you've written advocacy for me means expressing myself as I stand for human rights that create impact. So I'll touch on three things that you have mentioned so far as a collective. One is advocacy normally is stronger when more people are involved, as Joven has mentioned. Advocacy works well when there are partners involved, and you really have to work your networks to be able to get good results. We heard earlier that advocacy is action that is driven by you as, first of all, as an individual, and then through your collective, or could be your organization, or other platform. We've heard as well here, as Mercy has shared, that it means expressing myself as I stand for human rights that create impact. All these factors are involved in advocacy. I'll give you an example. When we talk of expressing yourself, Emmanuel, I see your comment there. When you talk of expressing yourself, a lot of that should come into your communication. When you start to communicate your advocacy message, you have to express yourself. You have to convince your targeted audiences, both the people that you want to support your cause and the people that you want to act on your cause. Supporters could be communities, fellow organizations, other young people that you need to sign petitions and so forth. And then the actors are the ones that can directly influence change for your agenda. You have to express yourself. Sometimes it is you speaking to a policymaker. Sometimes it is a collective speaking to a group of policymakers. Sometimes it's a newspaper article that you write. Sometimes it's a policy brief that you share. There are many ways, but all of these are about expressing a need and calling for change in policies, practices, attitudes, and laws. Emmanuel has reiterated the point of advocacy as a collective process towards demanding or influencing change. It's a very heavy idea to think of influencing change, because change, yes, is expected, but at the same time, trying to change things in advocacy, most times you're changing how people will live, how large numbers of people will live. You can be advocating to change policies at district level. That's a lot of people. Provincial level, national level, global level. You are standing in the gap and representing people and trying to create a society that better reflects the needs of people. In advocacy, for those who are who follow politics, political science, you'll understand that a lot of our countries use what is called representative democracy, where we trust a few people to represent different groups and our interests. And normally that's according to constituencies. And for some, they actually are, you find these constituencies of youth, also constituencies of women's groups, and different groups as such. So when we advocate, we are saying the people that we have given the responsibility to represent our needs are not representing our needs in the way that we expect. And so we have to present to them an agenda that can help them present our needs better. So we feed into an already existing decision-making platform. You know, once you start talking about change, you can move quite deeply. So what I'll invite us to do now is to talk a bit also about the next step after we've looked at advocacy. Now, when we talk of advocacy planning, welcome to Jacqueline, and it's really good to see everyone who is joining in this call. It's very encouraging to see the interest. Hopefully, we'll also see the engagement during the course of this conversation. So now we've spoken about what advocacy is, but now we have to start to make sense of advocacy from a planning perspective. One person mentioned that advocacy is action. There is no advocacy if there is no action, but for there to be action, there needs to be a plan. So when we are referring to advocacy plans, we are referring to a set of tactics that are used to advance a set of advocacy objectives. So basically, an advocacy plan is about clarifying what you want to do, why you want to do it, when you want to do it, where you want to do it, who you are targeting, and what are the different elements that will be
Sasa hapa
involved.
tutaingiliana, niende kule conference.
in what you are doing, right? I see we have someone whose mic is on. Let me see. Please make sure if you're not speaking direct, just unmute. But if you have a point to share, a question to ask, unmute and ask, and we will take your questions on. So advocacy planning, this I would believe you all know. We all make plans. Probably when the day started, you said, okay, today is a Monday. This is what I want to do. Monday is the start of a new week. You said, okay, this is what I want to do for the week. So for me, I don't think I will need to spend that much time talking about planning per se, but I want to spend more time talking about the ingredients of advocacy planning. Well, there are different types of advocacy approaches. There are different types of advocacy approaches. These are just two of common advocacy approaches, some of which we'll refer to during the course of the session, and you'll read also in your guideline document. So we have what is called confrontational or adversarial advocacy. So here you are addressing the wrongdoing of policymakers using different tactics that are quite confrontational. So you're trying to garner public support and public awareness and drive attention towards an issue that you want to confront. Normally it's in countries, regions, or areas where policymakers are making decisions that are not in the best interests of your collective or in the best interests of the general public. And so you need to scale up to confront them and get the public and other stakeholders aware that this is an issue that needs to be addressed urgently. So that's where you have marches, protests, petitions. It's counter representation. So to find an alternative way to represent interests in that space. Then we have constructive advocacy. So this is more conciliatory, where you invite policymakers to collaborate. You use tactics such as meetings, alliance building, publicity, campaigns. So here you move with the assumption that the policymakers already are interested in your areas of interest. And so you are supporting them to continue to create policies that support your issues. So sometimes you will have allies within Parliament. Sometimes you have, for example, parliamentary portfolio committees that focus on health. They may focus on youth. They may focus on child rights. They may focus on disability inclusion. They may focus on gender equality, etc. So you find allies and you work with them constructively so that they can stand and continue to stand on behalf of the issues that you are interested in. There are different subgroups of advocacy. Some of them include insider advocacy, outsider advocacy. Within the school of advocacy, we have accountability. There's, horizontal, vertical, and so forth. It's quite a large field, but I don't want us to spend too much time on the definitive aspects of this. I'd like us to really delve deeper in actual advocacy planning, and then we discuss more from there. In your guideline documents that you will receive from the Y+ Global team, we have broken down 6 steps to developing an advocacy plan. Before you do anything, whether it is to create a message framework, or it is to prepare a campaign, or meetings with decision makers, you need to have an advocacy plan. And for a big chunk of the end of last year and early this year, we were working together to develop an advocacy plan, and we used a relatively simple template. And we started by trying to define the context before explaining what we wanted to do, where we wanted to do it, who we wanted to target, and what we expected to achieve. So in all the activities that we have, we need to go back to our respective action plans for our different organizations and cross-check if we have answered all of the questions. Because once you start acting, if you act without a good plan, a clear plan, you will not be able to tell when things are no longer working. You will not be able to smartly adjust your strategies or your tactics, because it will be very difficult for you to see which part of the plan is not working and which part of the plan is working better. The clearer your plan is, the easier it is for you and the people around you to implement. Advocacy normally does not happen, advocacy change does not happen quickly. It normally takes quite a lot of time. It's possible that the people on this call will start the advocacy work, but then other people will continue the work in their absence. So if there is a clear plan, it's then easy to continue to equip others to continue with the work of advocacy. Sometimes you are, let's say you are in CDF, and then you get this nice job opportunity from gender health in Tanzania. You know, yeah, economic empowerment comes first. You know, you might leave the organization, but then when you have a plan, you know that this work will continue even in my absence. Right, so I will pause here for now. I just want to know if there are any questions so far in terms of understanding advocacy and advocacy planning before I start to break down each of these steps for us to understand further. So do we have any questions? Feel free to unmute your mic. Or do we have comments? You know, do we have any experiences that we would like to share of successful advocacy planning? All right, so at any point during the conversation, do chime in. Let's keep this as engaging as possible. I will be asking you a few questions quite shortly. Let's make sure to engage once that starts. So the first step is your problem analysis. The first step is your problem analysis. And we have put together 6 questions that can help you to analyze the problem. As you analyze the problem, it becomes easier to map the actions that need to be taken. It becomes easy to map the audiences that should be targeted. It becomes possible to start to think about tactics that you should employ. So these are the 6 questions. First one, what is the problem? So this what question includes a question of where. Where is this problem housed? For whom is it a problem? So who is affected the most? And who is affected after the fact? So what are when you look at the affected groups, who is affected the most? And it continues with degrees of affect. You need to ask yourself as well, what are the root causes of the problem? Why does this problem exist to begin with? This is, sometimes you might find, this problem is because according to these social norms, this is how this is done. It might be maybe 75% of the population have a certain belief system, and according to the teachings of that belief system, it is unethical or immoral, in quotes, to provide services to this population. So what are the root causes of the problem? Why does the problem exist? And why does the problem persist? Those are important things to think about. You also need to find out then what needs to change in order for the problem to be addressed, both in terms of here and now, but also in terms of the root causes. So what needs to change even at the root level of the problem? And one of the questions people don't ask a lot is, why does it need to change? You may say, because we feel like it, because 20 young people met and they said this is important. Yeah, that's a reason why it needs to change. But what are the deeper reasons why it needs to change? Now you need to ask yourself about, for example, the right to life, the right to health, freedom of choice, constitutional rights. You can take a rights-based approach. Normally, I find that to be very easy to then justify why certain things need to happen because they go against the rights of individuals. But you can also refer to research. You can ask people what they need. You can ask young people affected by the issue, why do they think the issue needs to change? And you gather that information and it will help you when you start to communicate the need for change. The other question you ask is, who will benefit from this change? So you've said, for whom is this problem important? And normally that question is closely linked to who will benefit from this change. Human beings, we are very logical most times, and we are also relatively self-interested. And most times when you ask someone to change, they'll want to know, how will this change benefit me? How will it benefit the people around me? How will it benefit the people I am accountable to? How will it benefit maybe the people in my population group? That could be my community, my district, and so forth. So you need to ask yourself, if this changes, who will benefit from it? And you separate again, who benefits the most, and as it continues. So at this point, I'm going to ask us to write in the chat, what is the problem that your organization is trying to solve through the work that you have planned in the Youth Care Project? Just write or type the name of your organization and just highlight, what is the problem that your organization is trying to. Is the instruction clear? So what is the problem that you are trying to change? Just type in the chat. Type in the chat. If you are having trouble with the chat, feel free to unmute your mic and share. But let's talk. Let's talk for a few minutes before we move to the next bit. What is the problem that your organization is trying to change through the Youth Care Initiative? So I'm inviting folks here, Mercy, Jovin, Jerry, Jacqueline, Emmanuel, Alice, Asha, Brian, Arnold. I'm inviting us all. Let's share. Let's share. What is the problem that your organization is trying to solve? Or maybe it's more than one problem. Maybe there are several, 3, 4. Let's type so I can reflect on this. We'll connect the dots with the problems as we continue with the session. What is the problem that your organization is trying to solve? Emmanuel from Copper Rose, Zambia says they're trying to address lack of comprehensive information on SRHR, HIV, self-care management. IREP, you're trying to address implementation of CSE at the community level. To speak of schools, availability of HIV commodities and services. Okay. Let's keep them coming. Let's keep them coming. I need at least two more responses. Right, I have Jovan saying limited SRHR information and services for adolescents and young people. Let's see if we can get one more. One more. Right, I have Arnold here. He's saying CDF is trying harmonization of Education Act and family guiding in access to SRH and HIV commodities. Okay, so I'm going to respond to each of them to help us understand how we can frame the problem better for our action planning. So I'll start with the CDF. CDF is trying harmonization of Education Act and family guiding in access to SRH and HIV commodities. You might find that the problem is actually lack of access to SRH and HIV commodities. And why? Now we're coming to the root cause. It means the Education Act and family guiding are not harmonized. And so young people are not receiving information in order for them to be able to access or demand SRH and HIV commodities. That's one example. Sometimes commodity access is determined by price. So what is the cost? Sometimes it's determined by geographical location. It's determined by the attitudes of health workers. Do young people feel safe? Do they feel like the environment is youth-friendly? Sometimes the commodities may not be there, especially self-care commodities. So young people may not be able to access HIV self-testing kits. And so they are unable now to access commodities that allow them the confidentiality that they need. So that's a way of digging deeper. And you have to look at statistics as well and find out in which areas is this issue the most prominent and which specific age group is affected the most. Is it all young people? Or is it 10 to 14-year-olds? Is it 15 to 19-year-olds? Is it 20 to 24-year-olds? Or maybe it's smaller subgroups, 15 to 17, 18 to 19. The more specific you are, the easier it is to come up with a plan that you can track the success of. So Jovan mentioned limited SRHR information and services for adolescents and young people. So the question will be why? Why is there limited SRHR information and services? Maybe it's provision of CSE in schools. Are young people receiving that information in schools? Maybe the answer is no. If that's the case, then why? So keep asking why. Why is there this? Why is there that? And as you keep answering those questions, you're getting closer to the root. The last one I think I will speak to is, I've spoken to the CSE issue and availability in schools. Copper Rose mentioned lack of comprehensive information on SRHR, HIV self-care management. So that's the problem. But let's specify. Let's identify again the target audiences. Let's be clear why there is a lack of comprehensive information. Is it the same for young people in school as it is for young people out of school? Is it the same for young people living with disability? Are we looking at everyone in the same way? Or there are specific needs that come up as you start to break down the problem and understand it further. So I just want here to have us remember the importance of being specific and continuing to ask why. It will help you to get to the root cause of the issue. Right. So now we move to the next slide. Oh, sorry, I see there's a chat. Naya, Brian, you've said strengthen healthcare systems for effective youth-friendly service delivery. Yeah, so here then, if you inverse that or turn it around, it means there's a lack of effective youth-friendly service delivery because healthcare systems are weak. That becomes the problem. Why are healthcare systems weak? Maybe there are no guidelines on how to provide youth-friendly service delivery, or there are no tools on how to monitor provision of youth-friendly service delivery, and so forth, and so forth. Maybe there's no budget for adolescent or youth-friendly services to begin with from the Ministry of Health. So there's no money to help in the delivery of that particular type of service. So thank you for your messages. One of the tools that I used, you saw in step 1, we analyzed the problem. In step 2, we have to identify stakeholders and also do a power analysis. When we talk of power analysis, I know some of these terms may seem very technical and complex, but everywhere we go, there is power. And I'm not just referring to electrical power, but wherever human beings interact, there is power at work. Even as I speak to you, there is power at play. And so when you look at advocacy, if you want to identify where and how and who, you need to identify how the power is flowing. Who holds power? And how can I influence the person who holds power to act on my behalf? Let's say you want to influence the president of Zambia to sign an executive order. It is almost impossible for you to get an audience with them. So who are the other people who have power over the person who has ultimate or most significant power? So you start to track. And at the end of your power analysis, you have a fairly good understanding of who you need to target. Sometimes we spend a lot of time and money trying to target individuals who don't have as much influence on our issue as we think that they do. And normally it happens because we haven't spent enough time analyzing who has power over the issue. So power analysis uses awareness of power to support advocacy change through fostering alliances and cooperation. This is politics. Advocacy is politics. You need to find out and understand, who am I working with? Who is working against me? Who is working for me? How do I work with the people who are working for me to influence change? Who has power over my issue? If I want a policy changed, then it means I need to target policymakers. Where do policymakers gather? Is there a group where policymakers gather that focuses on the type of issue that I'm advocating for? Okay, so let me focus on that. How can I influence these policymakers? Okay, who are the people talking to these policymakers? You have the constituencies. So you come up with petitions. You work, you do protests, you do policy dialogues with policymakers. You talk to media houses because policymakers pay attention to the headlines. And all of this, you are now starting to identify levers of power. Levers of power. When you conduct a power analysis, it's so that you can gather power for your advocacy issue. Power in politics normally comes in the form of people, influential people. A secondary tool in terms of power is money, but we are aware that we don't have the ability to gather that much money. So we need to be very tactical and very tactful in how we identify the stakeholders that we will network with. So it's about alliances and cooperation. In the guideline document that we will share with you, there is a power analysis checklist, which is a list of things that you can identify, questions that you need to answer. Actually, let me do it this way so you have an idea of what I'm talking about. Let me just pull up the this power analysis worksheet, the checklist. It will help if you can have a look at it. Then, so when we send you the document, it's not foreign to you. Okay. All right. Let me see if I can make this a bit bigger. All right. There we go. So can we see the Word document?
Yes, we can.
Great. So when you go to the guideline document, which we'll share with you, you will need to fill in the answers to some of these questions. So I used a case study looking at contraceptive access. So you have to ask yourself, who are the most influential actors? What is the influence of different actors? What are the networks that support and resist change to the issue? What are the norms? There are so many questions that can help you to gain a better understanding of the issue that you are trying to address. So that's what I'm referring to in terms of a power analysis checklist, a power analysis checklist. So please make use of the tool. Of course, it will focus now on the issues that you want to address and the problem which you have identified. All right, so when you have identified your problem and you have analyzed your stakeholders, identified your stakeholders, now you are in a very good position to begin to plan. Advocacy planning. Now you start to get practical. Before I forget, in the guideline document, we also present you with a tool that you can use for stakeholder mapping, stakeholder power mapping, where you list stakeholders and identify the power that they have over different areas of your issue. You will read that further. Now, when we look at action planning, we spoke about this earlier in terms of advocacy planning, but now I want to explain the areas that we are going to explore in the last, I'd say, 15 minutes before we have a question and answer, 15, 20 minutes before we have question and answer. So when we talk about action planning, mainly, we want to provide clarity on the change that we want to achieve. So we need to be specific in terms of the time frame. That's normally people plan on a quarterly basis, and beyond that on a yearly basis. Also, you look at geographic scope. This is important. The more specific you are, the more likely you are to bring change in that area. That includes your target population, as well as the elements to be included, which are the tactics. There are different types of activities that you can consider, and you've already done that in your action planning, which we did from November until around late February. So it's advised that you develop an overall advocacy message before you start to break it down so that it suits each target audience. We're going to have a session on how to create advocacy messages. We're going to have a session that looks at creating advocacy resources like policy briefs. We'll have a session on policy analysis. We'll also have a session on, for example, when you look at youth-friendly service provision, how do you monitor, and support the monitoring of youth-friendly service provision. So there are other things that we will provide you with support on and training on that will form part of your advocacy action plan. There we go. Right, so I need us to give some thought to this, and this is another point in the presentation where we have an opportunity to share our plans and our thoughts. I need us to reflect on our primary and our secondary audiences. I see this, whose mic is on. Okay, right, so we spoke a little bit about audiences in the power analysis. Normally, we have primary audiences and secondary audiences. And I have defined in some of our conversations in this session how you categorize these audiences. So primary audiences are decision makers with power to directly influence the change that you need. Secondary audiences are individuals and groups that can influence these decision makers. I hope this distinction is clear. So your primary audience is who can directly influence the change I am looking for. If I want to see new guidelines in monitoring youth-friendly services, which government department has the power to introduce those guidelines? Which parliamentary committee has the power to influence the creation of a policy that can make sure that that is compulsory in all the regions or counties of the country that you come from? So think of the problem you're trying to solve and ask yourself, who has the power to directly influence the change that we are looking for? That's the first step. The second step is, after you've identified the primary decision makers, which individuals and groups can influence those decision makers? Sometimes it can be CSOs, like civil society organizations. It can be religious groups. It can be fellow governments. For example, you have the SADC Parliamentary Forum. You have the East Africa community. You've got different platforms that can give you power or some level of influence to speak to the primary audience or decision makers with power over the issue that you want to address. So at this point, I just want to ask us to type again. Remember what you wrote in the chat. Remember what you wrote in the chat. And if you can, because I think on Zoom you have an opportunity to quote. There's a tool where you can quote what you've written already. So I'm proposing if you can quote what you wrote and write who is the primary audience. All I need is the primary audience. Which decision makers can directly influence the issue that you have highlighted? So for Copper Rose, lack of information on SRHR, HIV self-care management, which decision makers can directly influence this issue? So please just write that in the chat, or you can unmute and just share. Or maybe let's do it that way. So we'll start with Copper Rose. If Emmanuel is still on the call and colleagues from Copper Rose, which primary target audience or which decision makers can directly influence the issue that you highlighted? This is for colleagues from Copper Rose.
Okay, so with regards to the problem that we highlighted, the primary decision makers in this case include the parliamentarians, the Ministry of Health, and then the local authority, in this case, the ward councillors.
Great. Thank you from the Copper Rose team. I'll move now to IREP. You've spoken of implementation of CSE at the community level, and you're looking at schools as well as availability of HIV commodities and services. So which decision makers can you identify that can directly influence this issue? This is for colleagues from IREP.
So I'll just like mention randomly. I'm listening too much and my thoughts are distorted. I was focusing too much on, So I'm thinking of maybe government agencies, that is government bodies such as Ministry of Health, Ministry of Education, who can lead directly the implementation of CSEs. We have civil society organizations, we have community-based organizations, we have youth groups, networks. We also talk of healthcare providers, Then we talk of schools and educational institutions. Then not to forget faith-based organization. Then to add just for influencers, we have the media and the communication channels.
All right, thank you, Jerry. I can hear from there that there's also the inclusion of some secondary audiences, which helps. So we would just need now to distinguish and be very laser focused on the most important in terms of who is primary, so that we can target our actions firstly on the primary influencers. But no, thank you for what you've shared.
And focus for the government agencies, Ministry of Health and Education.
All right, thank you, Jerry. Mercy is saying the county AIDS coordinating team and county reproductive health and adolescents departments. Thank you for that. I believe that's for Naya, no, if I'm not mistaken.
No, Mercy is my colleague from IREP.
Sawa.
Government agencies again.
Okay, great. Then I have Brian from Naya. You said strengthen healthcare systems for effective youth-friendly service delivery. Which primary audience, which decision makers can directly influence or solve your problem?
Good afternoon, everyone. So looking at the objective above, it comes with quite a number of challenges which needs to be addressed, and the level of engagement that will actually influence policy is including the member of the county assembly as the primary target in our advocacy agenda. The MCS.
Okay. Great. Thank you for that reflection. I will then invite colleagues from CDF who spoke about trying harmonization of the Education Act and family guiding in access to SRH and HIV commodities. So which decision makers can directly influence your issue?
The Ministry of Health and the Committee of Health with the Parliament. The one who are directly making to receive the changes or receive the opinions from the different stakeholders, depending on the nature of the improvement within the law. We want to make some kind of reforms.
Great. Right, thank you. We have one more. Joven, you had spoken about limited SRHR information and services for adolescents and young people. Do you want to share your thoughts on who the primary audience should be? Which decision makers can directly influence the issue?
The local government authorities, LGs.
Local government.
Also, I think of the government, especially the local government officials, because when we influence them, they can influence the government on the availability of services.
All right. Thank you very much. And it's really good to hear the feedback. I know quite a bit of this information is already there in the advocacy, or rather the youth care work plans that you pulled together, but this really helps to make sure that we are all on the same page. So when we have opportunities also to strengthen our documents, this is some of what we can refer to. I know that a lot of our documents don't include the secondary audiences, and we prioritize the primary audiences, but it's essential for us to really think in a more systematic way, because change doesn't just take place from addressing or targeting one group. It takes place from addressing people at different levels. And so we also need to think about how before we reach out to the policymakers and government officials, how do we work with secondary audiences that can do that work for us? Sometimes you can leverage resources that way. I'll give you an example. If you work with UN agencies, They have direct access to the ministries that we work with. They also have relatively good relationships with policymakers, and they are apolitical. So they are seen as reliable or trustworthy allies of government because they don't work without government approval. But they also fund a lot of the government's work. So you might find that a secondary audience could be a UN agency that focuses on the issues that you're advocating for. And you work with them to engage now these policymakers and government officials. Sometimes you'll find that the thing that you want to see changed, there are other partners with more resources who also want to see the same change. So when you network, especially when you start to identify secondary audiences, you need to find out who else is already doing what I'm interested in doing, and how can I work with them or leverage their capacity to get me to the primary audience. These are tactics. These are tactics. Right. So when you've identified your audiences, now try and move much quicker through the remaining slides. We have to identify goals and objectives. So we have to identify what do we hope to achieve in the long term. When I say long term, we're saying 3 to 5 years. So yes, your work plan may be for a year, but before you come up with your tactics, you need to look at the longer term view. And then your objectives now, you look at what specific change or outcome do you want to achieve in the short term. So a lot of our work plans are short term. They respond to objectives. Yes, within the Youth Care Project, we have this overall goal. And so everything else we are doing feeds into that goal. But it helps if you think for your organization, what is your goal for the Youth Care Project? And you connect the current activities you're planning to that goal, so that at the end of 3 to 5 years or whatever period of time you've set, you can see clearly the progress that has taken place. So when we have identified the audience, identified our goals and objectives, then we can start to think about advocacy approaches. This is where it gets interesting. Others would say this is where it gets exciting because this is where now you start to come up with ideas. What can we do to influence each target, right? Each primary target, each secondary target. Sometimes you even need a strategy for individuals. Your primary target might be government ministers, but you need a different strategy for the Minister of Health than you have for the Minister of Education, and the messages are different. So your actions, your messages, your partners, the types of challenges you're likely to face, you need to take your time to unpack that. Unfortunately, during our action planning work, we did not have enough time to be able to fully unpack these elements. So it is up to you now as individual partners to take your time to make sure that you're coming up with the right actions and messages, partners, and challenges. Right now, I'm certain that all of us have specific actions that we've identified for the Youth Care Project, but our key messages are not very clear. So we have a session on key messages that will help you also identify how and who you need to target and how you want to talk to them. And you can even take some time through that session to figure out how will you do it. So what channels will you use? Of course, partners, we spoke about this in our power analysis, challenges. So without taking too much time, we also have to identify the tools, channels, and platforms that we will use, but that's up to you. You know what works in your environment. You have to come up with strategies that you think can make the biggest impact. Sometimes you can take those strategies from work you have done before, work that has been done by others, or new ideas that you want to test that can draw the attention of policymakers in a new and significant way. So that's up to you. And that's the power of youth organizing, because you have the capacity to come up with new ways of addressing sometimes problems that have been there for a while. So in addition to that, you also need to look at the budget that is to be spent. I know you all spend quite a bit of time with Ivy discussing, hey, we've got all these plans, but hey, you know, is there any extra funding? Is there this? Is there that? work within the resources you have financially, and find ways to leverage the resources of others through partnerships. Also look at which messages will inspire action for your cause. I don't want to preempt the session on message development, but I remember one person mentioned in the chat today that advocacy is creating change in an issue of one issue that you are passionate about. So advocacy is about inspiration. So you need to find messages that will inspire others to act for your cause. Identify what other support you will need, which organizations are working on similar issues, as I mentioned, and the obstacles that you are likely to face. This training is technical support, for example, that you identified that you need to help you be able to design better campaigns and deliver better campaigns. So that's support that Y+ Global are giving. But there are other types of support you will need. Maybe Y+ Global might not be able to provide that support, but there are ways for you to mobilize for some of those resources locally, and we can help you be able to do that. The last piece that I will speak to is monitoring and evaluation. So when you have, remember, your audience, your objectives, and you started to identify your approaches, and there's a whole list there, right, up to budgeting, then you start to look at your monitoring and evaluation. And your monitoring and evaluation is based on your goals and objectives. You look back at the goals you set and the objectives. I don't want to spend too much time talking about SMART objectives, etc., because I know you have quite a bit of knowledge on that as you've been working, within the development field. But it's important for us to be as precise as possible in our objectives so that it is easy for us to monitor and evaluate to see if our advocacy is working. A good practice is track regularly what is going well, what needs to improve, and how well you're sticking to your timeline. You can do this on a monthly basis. You can do this on a quarterly basis. You can do this activity-based. So once the activity is done, you sit down and say, okay, what worked for this? What didn't work? How do we improve for the next thing? But whatever you do, you need to do it regularly. I would encourage you, when you start off with your plans, increase or have a lot more regular check-ins. And then as you go on with the project, you can reduce the frequency of your monitoring. But at least now you'd have set trends and you'd have started to build a culture of effective tracking. You need to constantly think through how you will monitor and ensure that your advocacy is working. So here I see there's, I think there's a typo on this for some reason. Let me check. Give me 1 second. There are a couple of important points I want to share. I need to find out where this went. All right. And where are we? Right. So some of your, in terms of monitoring, you can look at, and this is, I'm drawing from your guideline document. You can do quarterly reviews. You can conduct monthly project reports. If you're doing advocacy work, you can look at Parliament minutes from the Parliament Hansards. You can look at Ministry of Health, provincial and district reports. You can look at social media monitoring tools that monitor impressions. You can have surveys, pre and post, that help you track if there are changes in knowledge and attitudes. So these are tools, tools that you can employ. You can also have an evaluation plan to say, at the end of this campaign project, we want to run an evaluation, a project evaluation, to look at the effectiveness, the efficiency, sustainability, and so forth. Another issue that normally gives us trouble is our indicators. So what is it that will help us understand whether we've succeeded or not? And so one of the things I would encourage us to do is to share our monitoring and evaluation plan for this project, so it is clear what our indicators are. So the Y+ Global team can help also to provide oversight as you see and track if things are working or not. Some of the indicators can be number of members of parliament who've been engaged to support legal reform, percentage of consulted members of parliament making written and verbal commitments, number of motions tabled before parliament, number of laws and policies changed, number of people reached with messaging, percentage of targeted audiences reporting changes in attitudes. There are so many things. Here we have also monitoring youth-friendly services. So percentage of young clients reporting access to youth-friendly SRHR services. There are different indicators that you can employ. So I would really encourage you to share your monitoring evaluation plans, because they will then help us to help you, so you can identify better indicators that are easier to collect. In terms of general advice in creation of indicators, it's easier if you have indicators that are already being tracked. Either you are already tracking them, or other organizations are tracking them, or government is already tracking those indicators, because then it will not be difficult for you to collect that data. So if you already have reports, like quarterly reports, activity reports, use those tools. It's difficult if you start to try to introduce new tools, because it can be very difficult for you to collect data. Consult other organizations that are also collecting data on similar things and see what tools they are using. It can help you as an organization to strengthen the monitoring and evaluation tools that you already have. In my other work, I provide monitoring and evaluation advice to the Yield Hub. And through the Yield Hub, we support many organizations that try and advance youth partnership in AYSRHR. So that capacity is there. If you can share your monitoring and evaluation plans with Ivy, I will also set aside some time within the course of this month to help you clean up your indicators and ensure your plans are straight to the point. So I plan to stop presenting at 3 my time, which is probably 4 your time. So I'll pause here. This is what we have in our session today. This is an overview of what is shared. There's a deeper document which has been sent, or will be sent to you rather, which is your guideline document, which the Y+ Global team will share. Now I just want to stop and find out, do you have any questions or comments that you'd like to share?
Hi, Emrai. You're talking to Jerry, and I just have one question, and I'm thinking in the context of advocacy in general, or rather you narrow down to like maybe social media advocacy. What are the odds? What are the odds, or rather, how can you, or rather, can you be able to predict the outcome of your advocacy?
Okay, that's a very, very good question. Okay, so that's one. Are there any other questions? So I might respond to them together. Let me see. Is there any other question? Oh, let me start with this one. All right, so I'll start with this one and then see if there are any other questions. It's very, this is from my experience. Yeah, I've been doing advocacy and accountability in different ways for quite some time now. And I've done some analysis, also evaluations of work in that field. It's difficult for one isolated advocacy approach to create change. Normally, you find advocacy is about generating momentum towards an issue until you get to a tipping point. So it also matters when you advocate. So part of the work that you have to do as individuals and as organizations is to understand who else is advocating on this issue. How far along, because we'll discuss this when we look at the policy analysis guidelines, and I share with you steps in policy analysis. One of the questions that you have to ask yourself is, at what stage is this policy? So maybe it's just about to be passed by Parliament. And when it's just about to be passed by Parliament, it's mainly about nudging the policymakers to see this as this is the right thing to do. People agree with this. So you can do a social media campaign that floods social media platforms with positive messaging on the issue that is being debated in Parliament at that point in time. And so if you target your advocacy, it can be very effective. But no one approach can achieve full advocacy success because human beings are influenced by different types of things. Decisions require many moving pieces for them to finally become something tangible. Let me see if I can give you an example. So there's work around child marriage. We ran a campaign on child marriage in Zimbabwe in 2014 into 2015. And we joined an organization called Roots Africa. We organized a session with young, or this what's called the junior parliament. And we organized an interface between junior parliamentarians and senior members of parliament. That was just one part. And from that meeting, we invited the press, and they documented a commitment that was made by policymakers to table the motion in Parliament. Immediately after that event, we held a street march. So to raise public attention, so that in addition to the article that would be written about the policymaker, they will also be supportive articles in the press, etc., about this march was led by survivors of child marriage. So we also found a way to accommodate and ensure that the voices of survivors of child marriage were front and center of the messaging on the campaign. Then, in addition to that, another organization called what's the, I'll try to remember the platform, but they're an advocacy platform. They took the government to court now in strategic litigation, led by some of the survivors of child marriage, who were also part of the march that we had been a part of. And what followed was a lot of other advocacy action, even insider advocacy, policy briefs, and so forth. So it was a concerted effort. We cannot achieve advocacy success alone. But if you can identify where your social media campaign will fit in an overall advocacy effort by other partners, then you are more likely to see results from it. Social media campaigns are very powerful in changing public or influencing public perceptions on issues and gathering impressions on issues. So that's where they can add the most value. They are not as valuable in getting policymakers to consider, new policies, but they're very, powerful in informing the public and starting to influence attitudes on policy issues. I hope that answers your question.
Yes. You've said so many things, and I was really open-minded, and I get the perspective and the aspect of, yeah. Thank you for that.
No, all good, Jerry. But I don't want you to feel limited as well, because sometimes social media can give you success you would not get from holding multiple meetings and so forth, because it also affords you a certain level of access to decision makers. And some decision makers are more prone to respond to calls made on social media than others. So again, it comes to targeting. I'll share one more quick experience. I remember in 2013, there was this Minister of Education, and we had been working with the AIDS Council in Zimbabwe to create life skills and sexuality education strategy, a new one. And it was supposed to be rolled out and launched, but then the documents were gathering dust, and it wasn't being launched because the Ministry of Education officials kept postponing because they had other trainings, other meetings, but donors were waiting for it to be launched so that they could support the provision of CSE in schools. So I wrote a Facebook message back when Facebook was still trending, and wrote it to the Minister of Education at the time. I had no relationship with this individual, but I just decided to take a shot. And that person responded and said, you know what, this is very noble. Send me an email with the details. I followed that up with an email, and then they sent that email to the directors within the ministry, asking them to act. So, as I said, social media can be a very powerful tool to share information. Some people may not know that this is what's happening. They may not know it's as bad as it is. And you have an opportunity to generate public outrage or to generate awareness amongst policymakers on issues that they are, every day overseeing. Sometimes they're too busy, and you might find them on social media trying to check the scores of the latest football game and comments, and then they bump into something which is very specific to what they need to act on, and it can have good results. So the point is, be targeted. If you can pick out individuals, moments in an advocacy approach by other partners, it can really give you the results that you need.
Thank you for that, Yemrai.
Thanks, Jerry. I think we have time for just one more question or comment before we close. Is there any other comment or question? Alice, Asha, I see Asha joined later. Brian, Mercy, I see your comment. I'm glad it was helpful. We have a few more sessions tomorrow. Please do dial in. We will do our best to have video on for those because they can be a bit technical. It helps sometimes to talk things through. Come prepared to participate. I would really love if we have the same collective or more tomorrow. Let's move together. I'll follow up with Ivy just to make sure we're making progress on the sharing of the guidelines. But otherwise, thank you so much for your time. Thank you, Esther and the Y Plus Global team. I hope this was informative. We're cleaning up the guidelines so we can share with you and you can use it. At the end of these sessions, we will set some timelines for feedback because we are expecting some action once these trainings are done. So by the end of May, we've started to do the work that we'd said we would do. Other than that, thank you so much and enjoy the rest of your day.
Thank you, Emrai.
Emrai, thank you for that. Cheers, my guy.